Welcome to the Cardio 360 video series brought to you by MuniMeterHealth.com. I'm Dr. Sharad Jaitly from New York. I will be talking to you in this particular video section, a very short vignette about an interesting fact that each time the climate changes or a person moves to a new region within the country or within the state, does it or does it not impact the heart condition that the person has? Well, the fact is true that each time a season changes, the person takes a little longer to adapt before he or she can perform the regular physical activity meant for that season, etc. So it's not uncommon to find an increased incidence, specifically so if somebody who has not been, say, accustomed to doing certain exercise in certain groups of muscles, and all of a sudden now jets out of the house and starts doing shoveling, for instance, now at the beginning of an onset of the winter, or resorts to go to a skiing facility. One, you'll have an altitude problem where the person is not adapted or accustomed to it, and two, obviously, you need to be in good shape before you can go out and undertake some sports. So I call them risky behaviors based on these region changes and or climate changes. And again, not all of this has been defined so clearly yet. And and there are anecdotal reports where people have gone out swimming and playing tennis at the onset of the summer and they've had a stroke. Obviously, their blood pressures had been normal to begin with and they were uncontrolled. Say if somebody's starting with a pressure 120 or 80, will be able to handle it better on a tennis court in a hot, sultry weather. But if somebody already has a pressure 180, 110, and again, quote unquote, the patient feels fine. And that's why hypertension is a silent killer. So that person can either develop a stroke or can actually make one of the plaques within the stents, if there's a stent in that person, or if somebody has just atherosclerosis, like I've shown the plaques here, the blue plaques. These are inner thickening within the intimal layer or the inner layer of your artery. And as a result, these plaques can vulnerably rupture, and they're highly vulnerable in this region. As a result, they can shut off the artery and the flow can be limited rather critically and severely, leading to either a heart attack or to a stroke. Not uncommonly, patients have aortic stenosis, for instance, or mitral stenosis. Now, these are valve conditions which are very, very prevalent, and one should not, again, undertake significant, serious, severe physical exertions or activity or sports. Specifically, so that has been advised not to do so. Now, many times patients may not have followed up with their physicians, or sometimes mitral stenosis, for instance, or aortic stenosis could be so insidious that the physician has not had a chance to do an echo, or perhaps the person himself or herself has not followed up with the physician. So now, all of a sudden, if a elderly person decides to go and take long walks on a hot summery day, or decides to step out in the wintry weather, the cold draft can generate enough tachycardia because of the oxygen consumption that happens in the cold weather, and that could lead to significant mitral stenosis hemodynamics or aortic stenosis hemodynamics worsening. So, I mean, there are tons and tons of examples, but in this short vignette, I just wanted to define that adaptation to the climate or to the altitude is as important as is conditioning for a sport or a physical activity. So please observe precautions, specifically at the onset of the new season. We know the winter is over here in the United States and spring is here, but I can cite you examples after examples where younger people now are suffering from heart attacks and they get admitted. Next thing is they're going for an angiogram and they're getting a stent placed. So it's not uncommon to really, at the change of the season, see that there's an increased propensity. We know there are certain holidays that really make one prone for certain conditions which I've talked about, like the holiday heart syndrome or I call it a Saturday night um, heart alcoholic problem. So, but these are some of the conditions that one has to really keep in mind, because you are going to run into these problems in your clinical practice. But for the general masses, for the general people that I'm addressing, I think it's very, very important that go and see a physician and say, look, I'm planning a hike somewhere, later in the summer. I just want to make sure that I'm in good shape, even though I had a heart attack last year. Or I just had a stent placed about 6 months ago, and therefore I need a good stress test, making sure that I'm ready for my swimming or my other physical activity, the change of the season which I entail to do with my family. So it's very, very crucial for all of us to understand that idea is not to just go out and start shoveling just because it snowed last night, and next thing is, you're proning yourself. Now, what if you have an aortic aneurysm? Have you been told not to do so, or not to do any physical activity? What if you have a stent, and which so far was running very, very stable and keeping things going well within the heart, but now all of a sudden you have prone yourself into a cold weather, into a cold draft, and lifting up snow and moving, shoveling around is very, very dangerous. Likewise, within the house, for instance, even if you start moving furnitures, like you've moved into a new house and you're lifting up big couches and tables and desks, that's not advisable at all, because you're not prone for you're not adapted to these various what you call physical activities. And all of a sudden, if an individual starts doing that, it takes a while to condition yourself. So please, please go and see a physician first before you entail any of these extraordinary physical activities, if I normally call them, or if you decide to move into a new region like a cold climate or a warmer climate. People moving up to cold climate can actually adapt better for certain conditions, whereas the heart failure patients perform better in the warmer climates because of the vasodilatory effects that normally occur in the settings of that's precisely why many elderly people you'll see, they will all migrate to Florida or southern states. And the reason is because that region is very, very conducive to their cardiac climate, if you will, like specifically the high blood pressure or even the heart failure patients. But in general, as long as somebody is in a controlled environment and regularly exercising, one should not have or expect any major problems, but be extremely wary of the fact that any change of climate or season or region and indulging into unusual physical activity at that point will lead to or can lead to huge problems rather abruptly, like a heart attack, a stroke, or heart failure secondary to a valvular condition, etc., etc. And likewise, it's true even with the rupture of a plaque within the stented artery. I thank you for your attention. Again, please continue to watch on MuniMeterHealth.com, your favorite website for cardiology learning and teaching. And please continue to like underneath the video and do comment. Do not forget to share with your loved ones. I always say, because you never know who will benefit out of your family, your friends, your patients, and your colleagues, and your students, etc., etc. I thank you for your attention. This is Dr. Jaitly again. Until the next video. Bye.